First, I'll explain to my patient. I'll be checking 40 acupuncture point. In this particular program will be about 50 acupuncture point to map out your energy pattern, the meridian system. So I'll be checking 40 main acupuncture point to map out your meridian system. And I will try to explain to you in analogy with tuning the violin. So think of your body as a fine musical instrument from Washington State with a special violin with 40 strings. And I'll be checking individual string to find out which string, how many string, what degree, and what sequence of out of tune. They'll give me a clue what's going on with you. While I'm evaluating, I don't focus on your either symptoms or diagnosis because I don't want to be influenced or interfere with the pre-existing conditions. I just map out what's going on and it doesn't make any sense at all right? So that gives some clue. And if you can you take your watch off, take your socks and shoes off, please. And I do usually wear gloves on my left side to minimize my conductance with him because I'll hold his hand with my hand. Yeah, I don't like latex gloves. It's not good for my skin, so I'll avoid that. Yeah.
But they use like a vinyl glove.
It's a cotton gloves. You go to one of the Asian market for very inexpensive. Put your foot together, please. Foot together. Yeah. Put your hand down here. Yeah. Give me your hand here. I usually feel for the moisture of his hand. He look fairly nice moisture to it. And I want you to hold on him, and I want you to hold on here. I'm going to check hand to hand, make sure you have enough energy for me to evaluate him. So let's check. He's at about 90, 95. That's not bad. That's pretty good. You got plenty of energy for me to evaluate him. Some people might be say, a little bit too high, but that's totally acceptable. So let's.
What is the level that is under?
About 80 to 90. This is what I like to see. People's skin is very dry. Sometimes it will be 40 and 50s. So you have to put some moisture on. Now that's hand to hand. In this particular program, they go to hypothalamus. I don't usually do that. I skip this one here. And we're going to go to the hand, all right? So now that point is a lymphatic system of tonsil on the right side. So let me just check here. So he's reading it about 61, 62. That's not too bad. It's a little bit high side. Every equipment has a different sensitivity to it. So this particular equipment up to maybe 60, maybe it might be within normal range, but it's not too bad. And we are looking for the indicator drop. I don't pay too much attention to it, but from my point of view, this is a test point. And then we're going to go to the next point. That's dental point, and let's check. It's got a little bit low side there, about 42, 43. Okay, go to
So
the.
we've got a tooth on that side that's going to be pulled next Friday.
Oh, you got some dental problem. What kind of dental problem do you have?
Oh, it's a number 1 has some abscess around it.
Okay, so what happened with that? Whether your blood pressure will come down or not?
Yeah, that's part of the question, and so I was curious to see
Yeah.
if you'd pick something up.
Just right away, yeah. Now we're going to go into your lung meridian. That's kind of, again, low normal at 46.9. Now going to large intestine. Again, low normal at 46. Central nervous system. Low normal at 46.9. pericardium representing circulation. Looks okay. Checking for allergy point. Got some chronic allergy problem. Always checks, whenever I see one problem in allergy point, I check for second allergy point. This particular allergy point, I'll be thinking about hidden heavy metal problem or fungal problems. So I check for his another allergy point. So he's got all 3 out of 3 allergy points showing up out of balance. Although I document only 1 point, but I check extra point. So I say 40 meridian, but I check actually 50 to 55 points. So he's got some chronic allergy, immunology problem. I'll be thinking about heavy metal, fungal problem, food allergy problem, environmental allergies. The fact he's an environmental medical doctor, so I'll be thinking about he's got some major allergy problem. That's how I get into environmental medicine anyway to begin with. But he wasn't thinking about parasite. So,
No.
all right, for cellular metabolism, cellular degeneration point. It's kind of a low normal, yeah. No, low at 43 points, just slightly off. And now we're getting into what we call triple warmer, the controlling hormones. It's a little bit low. This point is called control point. This is the main representative. It's a little bit off. I want to see how his other point is showing up. So we'll get into a thyroid point. Okay, just a little bit low end at 42.8 and checking for adrenal. They're all kind of a low end, but at least it's not below 40. They're about 42, 44, 43, something like that. So it's a little bit, hormone is out of balance. And he's 67 years old and got allergy problems and dental problems. They may all play the role. I do not treat this hormonal point. Often it will rebalance on its own if you can correct the underlying problem. So let's check for his heart meridian.
Thyroid also?
Yeah. His heart meridian is low and small intestine also low. So you remember I said when I see dental, heart, and your small intestine, it's usually all wisdom tooth area growing. He's got small, maybe some kind of abscess tooth at where? Which tooth?
Number
here?
1.
Number 1. Oh, that's a wisdom tooth area. Yeah, so
Yeah.
that might be part of the problem. But never listen to your patient. It's a number 1. It could be number 16. It could be 17 or 32. You have to check all those things. We'll get to that a little bit later. So switch your hand, please. Now we are measuring your mirror image of your right side. Now measuring your left side. So let's check for lymphatic system of tonsil. And checking for dental. It's kind of a little bit low at 42.6. Checking for lung. Says okay. Checking for large intestine. Says okay. Checking for central nervous system. And checking for pericardium. Okay, and checking for allergy point. It's off, so we'll check for extra allergy point is low. So all 3 out of 3, both sides, 6 out of 6 allergy point is low. To me, his immune system has been compromised. He's 67 years old. I'll be looking for other point, but if you have like a pancreas, liver showing up, I'll be looking for like a screening for cancer profile as a part of the risk factors. Just it'll come to my automatically, you know. So checking for cellular metabolism. And checking for triple warmer, controlling his hormone. Low. Checking for thyroid. And checking for adrenal. So it's low. So both sides adrenal reading is low, or the hormone is low. So he's tired, he's pushing along. It's just, you know, working.
Two nights without sleeping much, does that make an impact?
Oh, sure it can. But it's just, you know, you're pushing along, you know, it's just.
Okay.
It's a heart meridian. And for small intestine. So he's got probably cavitation around wisdom tooth both sides, not just one side.
Well, it's interesting because I had the wisdom tooth pulled over here because there were some issues, and the surgeon pulled it, and I asked him to clean out the ligaments. So he didn't want to have anything to do with that. So I still have some soreness there, so I think that might be an issue. That was probably 3-4 years ago.
Okay, so yeah, we won't get into that part, but when I see dental, heart, and small intestine, I call that a time bomb. I didn't say ticking bomb, but it can turn into a ticking bomb if it's not done correctly. So we need to find out, you know, this one patient has some kind of a symptoms. Palpitation, vague chest pain, you know, all kinds of problems. But anyway, we'll see. Now we're going to go into your foot. Hold on there, please.
Okay.
And I want you to put your right foot, please, here, all the way down, all the way down. Now we're going into your pancreas. And another pancreas. And for your pancreas point for uric acid metabolism. Now I don't usually check all that point. Unless somebody have a diabetes, I check extra pancreas point, but this program has a built-in to check for multiple pancreatic point. So something about uric acid metabolism is out of balance. So it can be from what's the underlying problem for uric acid, maybe because his diet perhaps, or maybe he's got some kind of a gouty-like symptoms, joint pain, or maybe a fungal problem. Because Constantini talks about, from WHO, talk about uric acid problem is actually mycotoxin fungal problem, you know.
Right.
So just knowing he's an medical doctor, he has to be attracted to fungal and mycotoxin problem. Anyway, we'll see.
Okay.
And checking for another pancreatic point. Also, it is low. That's referring to carbohydrate metabolism. So I'll be thinking he may not have a diabetes, but he may be sensitive to sugar. So he may have tendency of hypoglycemia. It affects on his energy level. But anyway, I don't know. But you know, I'm just speculating at this point. I didn't want any too much information. He doesn't want to reveal all the information anyway until you tell patient what's going on. You know. And next point is another pancreatic point. That one is okay for fat metabolism. So the pancreas got uric acid metabolism and for carbohydrate metabolism is a part of his problem. At least it's out of balance. So now let's check for your liver.
Wait a minute.
Uh-oh. What happened?
This one,
This one.
There we go.
Okay. Okay, let's check for your liver. And joint. And for stomach. Looks good. And for connective tissue. And for skin. And fat metabolism. And for gallbladder. Oh yeah, so it's off. I mean, when you talk about 30, that's statistically significant. 50 is considered properly tuned. By the time the reading is in 30, it's become physically symptomatic. If you ask me, do you have any foot problem, ankle problem, hip problem, any pelvic digestion problem, backache, back stiffness. So a lot of times people say, yeah, oh yeah, oh yeah. People go through that process. Some of them are denial. There's, oh no, I don't have it, I don't have it. But I say, you're bullshitting me, But I've been doing this long enough, I can say that, But anyway, I didn't mean yet. They will just, And checking for kidney cortex. A little bit of an indicator. That's what we call indicator drop, actually. It may be significant or not. I also pay attention to not exactly the point, but that's what I call classic indicator drop. He may have some kidney problems, It's a slightly different program. It's a bladder meridian. And prostate. All right, those are prostate. Let's go to your other foot, please. And, and sit to your other hand, please. Try not to cross here. Yeah. All right. Now checking for your spleen. And for your liver. And checking for your joint. Kind of low normal. And checking for your stomach. And for your connective tissue, and for your skin, kind of low normal, and fat metabolism, and for your gallbladder, both sides is low. So one gallbladder meridian in the left side is low. They're referring to biliary area. It's a problem, not gallbladder itself, but biliary area. The gallbladder meridian controls the movement. So it means when the both side is low, they kind of make you stiff. The gait is not fluid anymore. I'm not sure if you have some stiffness, but I'll let you. Let's see whether you can run or not and see the motion of your running. That's your kidney cortex. And for bladder meridian, it's a little bit off. Let's try one more time. It's a little bit off, so how often do you wake up in the middle of the night to go to the bathroom?
Once.
Once? It's not bad. Any problem with urination, stream-wise?
Hey, it's slower than when I was a kid, but it's okay.
Sounds like a denial to me. Nice. Not like when I was a kid, you know.
Plus, yeah, it's true. I've got a 14-year-old, and boy, I can hear him, and
And this is
It's
a
not
prostate. All right, so I just checked here about, I think, 50-some point in this particular program. It's already built-in program. Let's put your foot down, please, and let's take a look what we got here. We're going to save this information. Session to be, save the session, and save to the database. And we're going to take a look. Let's see. We can take a look. We can print them out, and let me see. And they give out the score. Let me see. One of the main problem is coming to one of the lowest reading is in this. Here it says your gallbladder meridian on the left side, you got some allergy problem, small intestine, adrenal, gallbladder on the right side, endocrine, triple 1 system on control point, allergy problem, small intestine, kind of repeat itself, your heart and heart. That's usually wisdom tooth areas. And sugar metabolism, carbohydrate, uric acid from the pancreas point, more hormonal system. Some of your bladder meridian showing up, and dental, got some thyroid problem showing up. Those are statistically significant. And some of them are what we call indicator drop showing up, but I don't pay way too well on this indicator drop. But anyway, they give you sort of kind of clue what to look for. This is going in a kind of a vertical. I like to use the horizontal graph because that's what I'm used to. So I don't use this equipment. I do have 8 different EAB equipment, but I just want to give you read out, sidebar. So then we need to focus on based on the information. Just knowing what I know here, I'll be thinking about you got some parasite problem. I got some major hidden dental problem. And I don't pay attention to your diagnosis. You see about high blood pressure, but that's secondary problem, not primary problem. So I'll be going through this process. And I don't pay attention to hormone. I expect hormone will improve if you go through parasite cleansing and dental problem. If they were all hormonal symptoms, I may do later on after dental work is done and parasite cleansing is done. And then see what your hormone, like a testosterone, what DHA level is. But I don't do that in the beginning. And any questions about what I have done? I don't use this equipment every day. I have a lot of just EAB, but I do very quick, very fast. It doesn't take that much time for me. I do 40 points in about 5 minutes, at the most 10 minutes. And I use a different contrast, to create any hidden problem patient may have. And that's what I do. So we'll practice on parasite medications. Maybe, shall we do that later on? We can do it now or later on. But let's take a break a little bit here. So let's go for your foot. May I have give me your both foot, please. And let's use the right one first here. Go to the other hand. So let's double check here. So let's check for reestablish your baseline, all right?
Okay.
It's low, right? So now I'm going to just random using this is a Oh, I'm not going to tell you. See what that shows. There's no what I call resonance. There's no change. It's septal. Now let's try something here. And there is no resonance there. It's a clindamycin. So let's try. I usually do, because I've been doing it long enough, I do this, what is this, mebendazole. So ivermectin and parental palmate often will balance. So let's check. Or yeah, it's back to what it should be. Just there's a 30-point drop. This is this is a concept of a bioresonance phenomenon. So now you can try something else rather than this. Let's say albendazole or mebendazole. Okay. It does help, but it's not strong enough. So let's try albendazole together.
These are so close, that shouldn't change much.
It looks better, but not what I want it to be at 50. So it's not the best choice. But if there's only one, I may have to use it, but it will not be my choice. And so we got this gallbladder meridian. Let's check his biliary areas on the left side. Switch hand, please. His gallbladder reading on the left side was also about same, and let's check. It's still a little bit low and normal, and from my point of view, I'll be, wait a minute, it's not there. This way it's not there. I'll force it, but it's not bring it up here.
You need to change to the left.
Yeah, it's to bring it up to normal there. Now let's check down here. Put your foot down, please. Yeah. Check for his triple worm of the hormonal system. His hormone system balance out adrenal and triple one, you kind of balance throughout. But let's check for his dental point. It's a slight improvement, but no dramatic improvement. That's for his heart and small intestine. There's no improvement because there's no resonance to it. The heart is a separate and independent problem from his, parasite problem I was picking from the gallbladder meridian. He's got some allergy problems, so let's check his allergy point. He balanced right, so he may have some underlying allergy problem from what I'll be thinking about parasite problem. So that's how I process my mind, and. At least for me as a medical doctor, I think it's kind of easy to follow. Does that make any sense? Oh, come on, Terry, you have this look in your face.
Well, this last one,
Oh, this is an allergy point here.
the allergy point
They were
was-
quite low.
Yeah, I know, they were quite low.
But there's just two different parasite medications in here, kind of balanced throughout.
Okay.
And-
Vacuuming off the parasites, the allergies are.
Yeah. And small intestine,
It's better.
better, but not what I want it to be because of the influence by the dental problem. Yeah.
Simon, can you check the meridian along the allergy to see?
Oh, yeah, okay, yeah, sure. And different allergy point. Not that one. So that particular point, I'll be thinking about like a fungal problem and heavy metal problem. I don't have any tray for antifungal and anti-heavy metal remedies, chelating agent, but then I'll be looking. Everything should be in my tray so I can check into it. Yeah.
chlorella on them, see what happens?
I'm not going to get into those radionic about that. Yeah.
So what about this,
Hmm?
this allergy?
Oh, that's the allergy point, yeah. This is a control point for control measurement. It looks better. Let's check for your extra allergy point. No. So
What
within,
about heart over here?
yeah. Oh, it looks better. Whatever the reason is, it looks better.
So potentially,
This
there
is
could be
fine.
parasites in the area for,
And I'm checking for your dental.
still not,
Hmm?
still not. where it
No,
should
it's
be.
a dental problem. For some reason, your heart meridian improves. I'm thinking maybe. Don't tell me you got some heartworm. Guess what? Guess what this ivermectin and parental palmo is? They sell as a dog as a heartworm.
Ah.
Yeah. But it's on your right side. They're referring to more like a right side or like a pericardium type, sac of the heart. More on the left side of the heart is more like an endocardium. So it's a little bit different. And maybe influencing your heart rather than the heart, the parasite in the heart itself. So you have to think about the process of
Yes.
thinking. Yeah.
Interesting.
Anything else we need to check on you?
You might check the,
Oh yeah,
uric
the
acid
yeah.
and see.
Oh yeah, pancreas. Hold on for a second. Yeah. So his uric acid reading was off. Let's see. At least bring it to almost low normal. Yeah, and check for carbohydrate metabolism. Again, at least bring it to low normal range. Sometimes something else is going on. Usually superimposed with a heavy metal. Or let's look for add-on tinidazole. Because the protozoa also love to go into pancreas also too. No difference there. So let's check for fluke, where there's a fluke. So we'll use a praziquantel. And actually, let's get a better reading. Yeah. So. So I'll be thinking now, maybe you have also fluke, pancreatic flukes. But can I really say that? No.
If you had
But-
flukes, you could put that in there.
Well,
That's what Wool used to do.
yeah.
The flukes.
Well, there are so many different kinds of flukes, But I know by the praziquantel is a drug of choice for all kinds of flukes, liver flukes, pancreatic flukes, or flukes of many kinds. So I use this as a means quick and fast. Because if you don't have a specific name of the fluke, then they do not resonate, so you can miss it.
Okay.
Do I want to really name the name of the flukes? I don't.
Is this actually better? The question is what will work to help it.
Yeah. So now let's go back to your dental point. Oh, wait a minute. How the hell dental reading gets better? Maybe what he have is maybe like a tapeworm with end flukes. Now his jaw can really relax. So let's look for your heart. And small intestine. Yeah, it looks okay. Now let's check for your other side. So the story starts changing because you have to spend that time in. Let's check for dental. So it's a little bit low side for dental and checking for your heart. Yeah. Checking for your heart. No. And checking for your small intestine. I was still thinking about your dental is influencing your right side, but somehow on the right side, maybe he may have some bite problems, his jaw relax when you give a right kind of a, parasite medication.
So can you tell whether it's the number 17 or number 16?
We'll do it, yeah. Hold on there, please. So let's check for dental as a baseline again. And take those two fingers out, yeah, and touch number 16 up there, yeah. No dramatic improvement. Let's go for 17. No, I think it will be more like that way, yeah. No? Then let's go for, could be, yeah. No,
I think I just, all right, this is where,
no, I want you to go to, no, let's go to, yeah. This is around number 32. Now, I want you to understand that when I say left side, there's 80% is the left side, the 20% can be on the right side. It's important. Like when I check for the lung, it's the same thing. So from embryologically, the way we evolve, it's like when I see left side, it could be left side or it could be lower jaw. When it's the right side, it could be right side or upper jaw. But there are always a few percentile can be on opposite side. So when I said looking for the left side, because left side, but it wasn't really resonating. So I'm looking at it now. It's a number 32. It might be the real problem. Now I can go inside the fingers and go check which level it is. But no, it's number 32 from my point of view.
so this will help that, whatever.
No. Go back to you. So this is for the parasite problem. Now let's check for your dental problem here. This is your baseline. Let's go back to your number 32. It kind of balance out, but we need to say where you're at. We need to cross-check. It has anything to do with his heart and small intestine. So we have to cross-check. Yeah, it says it's influencing his heart and small intestine. That's what we call cross-checking.
So then, what would be done here? So ozone,
No. Usually, for me, I refer to oral surgeon here, or it can be Dr. Cook, can do in Wisconsin. Yeah. I don't know anybody in Washington area,
okay. Well-
Does it matter that you have the parasites on the tray?
Maybe not. That's a quantum effects. And somewhere along the line, I don't care. Because this is a separate independent problem. The parasite mechanism is improving his right side with the jaw and part of the heart. I don't know why, but
I mean, when you think of organ and tooth relationship, is the tooth causing the organ problem, or is the organ problem causing the tooth problem?
so shall we take this thing off and see what happens?
Yeah.
Well, what I'm thinking is that you're treating the small intestine part with the parasite, making his
Thank you.
right tooth better.
Thank you. Well, you start thinking like an internist. All right, let's check for the other way around here. Yeah. And so and you have to be careful. This is a fiber optic can break.
Oh,
so.
okay.
Go back here again. So here's a dental. Here's your heart and small intestine. Now touch that number 32, yeah. Yeah, well, let's go back just a little bit further back, yeah. Definitely says yes. Say where you're at, and the heart, and small intestine. Yeah. So now I'm not influencing with the parasite medication. That's what she was concerned about it. So I removed it. Yeah. Saying that sometimes I'm not aware of there's something in there I measure, and then sometimes give a little bit different readings. I think no matter how much we try to be neutral, sometimes there are certain influence of our intention, attention, all this can play the role. But trying to be as much neutral as you can. So, because when I check, I thought I didn't know, I forgot there was a parasite medication, and checking it's a little bit slightly different reading, but give you, maybe it's my intent to give some improvement that didn't bring you to the what you want to be. So I said, couldn't figure out and realize there's something in there that was not supposed to be there,
What if you put those drugs back on and retest his dental part and small intestine?
Oh, those are triple parasite medication? Where did I put it? Yeah.
Rental.
Yeah. Parental and praziquantel here, and no, it's ivermectin. Here is ivermectin. And you want me to check again? Again?
Right dental,
Right. Yeah.
right, the small intestine and
Yeah.
part, the what you just tested.
Appears like a low because it could be sensitized at that point. But let's check for your heart. And the dental point was almost like a low normal, and the question is, why does it look semi in between? Because sometimes the point gets sensitized, so you have to be aware of that point too. But heart reading was low. Small intestine looks a little bit better, but still cannot reach the normal point. You do this long time, you do it, sometimes you feel for it, It's not a foolproof system, but better than not having any system at all to guide you through.
Yeah. Much.
But don't be so sure of yourself. Even if I'm so sure of myself, I only say I'm 80% sure there's some problem there, number 32. Sometimes we have to go in, finger in, where the point is, behind where, but.
So in this situation, Simon, how do you decide, should you go after the dental work or the parasite first?
Well, I just had this one removed,
Number,
32.
oh, number
And so I'm
30.
having one removed next Friday.
According to my reading, your number 32 is not complete.
So maybe it's not healed completely yet, or?
Right, that's what I'll be thinking, yeah.
Okay.
Did you have
So
ozone in it
I've done it once,
after it was done?
after it was done. So I probably should have done it more and just see if that would help. So,
When the reading is low, if it is like a 35, 40, I'll say you may want to try ozone, but once it's below 30, 25, usually requires. Yeah. I'm just from my experience. Yeah.
so I'll ask him about that next week, next Friday.
Yeah, who is your dentist?
He's a guy in Seattle.
What's his name?
His name is Ali Reza
And or
Panapur. Do you know him? You must know him because you know the name. So,
Okay.
Where are you
very
from?
aggressive, he's very aggressive in cavitation surgery, so.
Yeah.
Well, Dr. Cook, would you be interested in having any comment? I know you like to use your own equipment.
On his condition,
Yeah.
possibly it didn't get cleaned out enough.
He's pretty aggressive in cleaning. I can
But it
tell
may
you.
not heal properly because of the parasite problem.
Yeah.
You see, I don't
Are
see,
there fillings in the mouth?
No. Well,
No fillings?
no silver amalgam, no gold. There are maybe 2 or 3 composites.
Composites?
But
Sometimes the filling makes the area look bad. And when you get the filling out, you see a change in the readings.
Mhm.
And it doesn't need much. I mean, a speck and all mercury filling left in a tooth can show up as being a complete filling.
Oh, yeah, another important point. When I see parasite problem and dental problem, unless you have acute dental infection and pain, I usually start with a gut cleansing and then nutritional support to make them a little bit stronger, and then send him for the dentist. Otherwise, we have a dental operation, it may not heal properly. That's why one of the reasons. So this is another important lesson. You have to be aware of it. Just because you're picking up dental problem, don't send to the dentist right away. You have to build the patient up. You know, he's been saying, I'm fine, I just have a little bit of a high blood pressure, but I'm in good health. But according to my evaluation, he's not so good as he may think he is. He's not very well-tuned violin as he may think. But he's been playing along for so many years, he thinks he sounds good to him, you know. It sounds good to me, you know. But the trained professional people say, no, you're out of tune, buddy.
No, that's what I appreciate. Yeah. Well,
That's how
I'll
I
do
explain
that.
to my patient, you know.
I'll get this rechecked. But, so what do I do now between today and Friday when I get this other one taken out?
You're gonna
Us-
take your 3 drugs tonight.
Where do I start now?
Rehabilitation surgery.
Would you?
Treat your parasite.
Parasite, drainage remedy,
Yeah.
the usual.
Yeah, parasite cleansing first. It'll give you a chance your body to heal. Because your body engages in two war at the same time right now. Dental infection, gut problem. And they're all interconnected by the vagus nerve. The vagus nerve will go into your, from the bottom up, from the trigeminal going down to the vagus brainstem. It'll affect your overall conditions, yeah.
So you think that'd be a better idea to wait on this?
Unless you have an acute problem.
No, well, it's not, I mean, it's not bothering me.
Yeah. You have a time bomb. I'm not sure it's a ticking bomb or just a time bomb sitting in number 1 or number 30.
Well, I want to get it out. But you think it might be better to do some other things first?
Yeah.
If you do the other things first, is there any chance that the tooth problem will clear up without?
Thank you. That's another good point. Sometimes they appears better, looking better. So his body can handle it. But I may see clue might be in the heart or small intestine may showing up. And I use a different technique, the light, frequency, all those things, and then all of a sudden dental problem shows up again. It means problem is not gone, but his body can handle it. So it may not be an immediate issue. Yeah. Oh yeah, that's another important part. This is why you don't rush into dental from my point of view. But somebody have a pain, then I send to dentist right away, pull the bad tooth out right away. Give your body a time while you're cleaning your system. Does that make any sense? Yeah? Kind of fun, isn't it? I mean, so we're thinking as a medical doctor, as an internist, looking at this, processing the information, So, I don't know, this is what I do every day, And not everybody get well, but don't get me wrong, So, I love a personality, temperament, interaction. I don't have
Yeah.
Yes, so,
Well, there's nothing where everybody gets well, at least that I've seen.
yeah.
And even the best, not everybody gets well. But if you get tough ones well a lot of the time, that's pretty good.
Right. And some people are so skeptical, especially dental, they don't want to do it. I sent to a biological dentist, whatever, and then they're not convinced they go back to their dentist. Oh, I don't have any cavitation problem. What are you talking about? The root canal looks perfectly normal. I don't have to do it. Then that's the end of our relationship because I cannot go any further. If there's a mistrust and whatever, then that's it. So you have to be aware of that part of it. Dental is one of the hardest parts I deal with, and this is where I lose most of my patients because they don't want to go through that part of it. Yeah.
Is it mostly cost issue?
Cost is one of them, yeah. And then they say, well, my dentist said everything is fine, And without any guarantee, they don't want to do it.
Well, and also, what are you gonna, there's not really a great solution, on the flip side.
Yeah. Mm-hmm.
I mean, what are you gonna do? I mean, I've got 2 front teeth that I've been looking at with root canals for 40 years. That's kind of scary, getting your 2 front teeth pulled out.
Guess you could put in a flipper or something.
That's exactly right, but So,
Big step.
yeah, exactly. So there's not good solutions on the flip side
Mhm.
of what do you do in alternative.
I may have all the implants and root canals, get the squamous cell carcinoma of the neck, and that came for my opinion. I say all your tooth have to come out. You have to wear a denture. They don't come back. they don't come back because they will not accept that. They get radiation and chemo, but they're not going to come back, you know.
Seems like partial, from what I've learned, partial dentures is the best solution for an extractive site. Because, you know, you think about implanting something onto a meridian, you know, it's a foreign object, it contains metal, zirconium, that's all toxic. So what I've heard from several different people is partial denture is the best thing, and it's the cheapest.
So anyway, we're going to practice this. We have all the table have some equipment there, and also I like to have everybody have some of the. I want to videotape this for Cass, Dr. Cook, Gordon Johnson, and Carolyn, all their chance, because today is a videotaping. We'll have more practice tomorrow, but we have a little bit less time for practice today. But we're going to spend the evening too. We're going to go for dinner. We'll come back and practice more, and I'll go over some of those parasite medication. All right?